At King's College, we've been using navigated transcranial magnetic stimulation for more than 3 years now, and this is for the pre-surgical mapping of patients with lesions in eloquent areas for both movement and speech. The vast majority of patients are neuro-oncology patients, but we have experience also with patients with vascular lesions such as arteriovenous malformation and cavernomas. Patients with brain tumor in eloquent regions are discussed in a multidisciplinary team meeting with neurosurgeons, neuroradiologists, neurologists, pathologists, and the common decision is made to select this patient for TMS mapping. Once the decision is made, patients attend a separate TMS clinic where they receive an MRI for navigation and then the whole mapping experience. The integration of navigated TMS and tractography is, I think, very useful for our patients because the two techniques give you different information. While the tractography gives you the anatomy of the white matter connections, TMS gives you the functional information, and by integrating the two, you can then have an anatomo-functional assessment of the individual patient that is important for risk stratification, guide your intraoperative mapping, and of course, it's very important also for patient counseling. At King's, we have a dedicated team that take care of the whole process of TMS and the integration between TMS and tractography. Most of the clinical mapping is performed by one of our physician assistants in conjunction with our senior clinical fellow for neuro-oncology that then analyzes all the data and put the data along with tractography in our navigation system, and that is extremely helpful to guide the approach and plan the surgical strategy dealing with these tumors in eloquent areas. Finally, at King's, we are using TMS as a research tool, and in particular, we have been looking at the impact of tumor grading on the motor excitability of the motor cortex, and also looking at integration between TMS and tractography. We have used both techniques to assess the impact the tumors have on the corticospinal tract. And this is a research that we do in collaboration with our Neuroimaging Center at King's College London. And we use a TMS and the results that come from this research also as a teaching opportunity for our medical students and junior doctors.